Welcome to the second day. My name is Bleddyn Rees. I'm delighted to introduce Katrina Lowes, the head of Vodafone Centre for Health with Deloitte, and she's from the Vodafone Business Global. A little introduction to Katrina. She leads the Global Centre for Health. She works with some of the world's largest organizations, bringing together technology and humans to create new health outcomes and build a better future for all. With more than 25 years experience as a global marketing leader in communications, technology, and healthcare industries, Katrina has worked in Europe, the USA, Africa, and Asia. So she's well qualified to be at our summit. She is a passionate diversity champion and has a BA in business studies and marketing. Welcome, Katrina. So I'm going to start off in good academic fashion and disclose an interest. And that interest is I've been a Vodafone customer for 35 years. I think my very first mobile was a Rocal Vodac, I think it was, phone. Yep. So I've been around a long time. So let's kick off by perhaps you can tell us something personal about who you are, what you do, and start from there.
Well, good morning, and it's great to be here. I guess my personal disclosure follows on from that. I started my career in the paging division of BT, and I have a famous memo that I kept that says these mobile phones will never take off, there'll be a flash in the pan. And so as in the paging division, I thought my future was set. And what a surprise, here I am 30 years later, and pages are still such an important part of technology in hospitals and healthcare. So part of my passion now is to say it's time to move on from pages. There's a lot more that we can do.
Well, fantastic. And we're delighted that you are the first telecommunications company to come to one of our summits. So it's fantastic to have you. So if we kick off with, if you can tell us a bit about, so what is, if you like, the Vodafone Centre for Health with Deloitte and the Alliance? What is it all about?
So we've just recently formed the Alliance, and we are bringing together Vodafone's connected health technology experience with Deloitte's very deep global healthcare practitioner experience. And what we've realized, we've worked together as companies with shared customers for a long time in the health sector. And what we've observed is quite often there are transformation programs which are human and behavior change and process driven. And then there are technology projects. And quite often what we've learned from the corporate world is that there's a big gap in the middle between success and failure. And it's that bringing together of the way people work with the way that technology can enable you. So bringing together both sets of expertise to say, let's look at how we can help make healthcare accessible to more people when and where they need it.
So clearly the technology, if you like, the infrastructure of telecoms is absolutely crucial to digital health delivery. And I'm conscious that Vodafone in particular, because we run an event at Mobile World Congress, and we've seen obviously the number of telecommunications companies who've been highlighting products and services then, and I'm conscious that Vodafone have been at the forefront of that. But why now? Why have you chosen the health sector, if you like, at this particular point in time?
So the Vodafone Institute recently ran a survey last year, and it said that 92% of the citizens that they interviewed believed that it was a time to really intervene in the healthcare industry, that great support was needed to the many amazing frontline people because of some of the issues that the pandemic had really brought into the spotlight. And we know that the EU and many national governments have a real agenda of using digitalisation to build back better. But at the same time, Deloitte have got a great piece of research that they've done with clinicians and practitioners that say there are many barriers to adopting these new digital capabilities. And so the pandemic has really exposed the fact that there are inequalities of healthcare. People are struggling to access the healthcare they need when they need it. And so bringing together our ability to make sure that transformation is sustained and hopefully build solutions that will accelerate that transformation, we can all work together to make healthcare much more accessible.
So I'm understanding that it's that unique interface between understanding the challenges around services and the consulting capability of Deloitte with your technical solutions, and it's marrying the two to produce practical, pragmatic advances. Is that the key to how you see the centre working?
We definitely do. And I think I'd take that a step further. One of the things that we know has to happen is we have to deliver continuous healthcare, whether you're in a hospital, whether you're in a sort of a community, or whether you are taking better care of yourself at home. And one of the things that we think is really important is we look at this from the practitioner as well as the patient's point of view. And that means we're really talking about mobility of healthcare. If you're going to deliver continuous healthcare, how do you continue as the patient leaves the hospital, maybe moves back into their own home? How can you provide that level of care when the clinician becomes virtual? But equally, how do we use the technology that people are really comfortable with today to help them take better care of their own health? And so I think it's that looking as a joined up care delivery path between hospitals, the community around us, and our own homes, and really accelerating the behaviour change we've seen amongst patients and citizens. It's accelerated faster than I've seen in any other technology adoption. So some of the the changes in comfort levels of people having virtual doctors consultations like we're having with our audience today. 18 months ago, the idea of seeing your doctor on a computer screen was really low down in the trust scales and in people really wanting to do it. Now, I think it's just become an accepted part of the way that we access healthcare. So between the two of us, we've got huge experience of whether it's inside the institution, whether it's the community of healthcare providers and other services that come together around the individual, or whether it's the individual themselves. And we believe that we can start to join up some of the transformations that have happened independently and look at that sort of digital society, inclusive healthcare capability.
And what is the product of the centre going to be? Is it that you're going to be producing thought leadership and papers that you're going to be publishing, and if so, what do you think you're going to be doing in the next sort of few months or the first year?
So I think a big part of what we're doing is not just the thought leadership and the visionary activities, but it's also the where can new leading edge technologies like 5G, like private networks and edge computing, we're just starting to really experiment with some of these new technologies, and they have a real opportunity to transform the way that healthcare is delivered. And, if you look at some of the work we're doing in the UK, we work with a company called Proximy to have virtual access to expertise in the operating theatre. Now, we've taken that for granted in the commercial world for 10 years now. So we can virtually bring in experts when machinery breaks down, or, you just need somebody to take a look and say, here's how to do it. We can really start to accelerate some of that experimentation, but in a safe and a scalable way. Because I think technology on its own is great, but technology that is adopted and incorporated into the way people work is where we're going to see the biggest benefits. And that's where we're looking at the psychology side of things as well as the technology side of things. What is it going to take to really speed up some of the digitalization of many different forms of healthcare today? So we're not looking at a particular care path. We're starting to look at where are the biggest barriers to collaboration, for instance. How do we get the different caregivers in somebody's experience to join up and to share knowledge and to come to a diagnosis or a treatment path faster. So the thought leadership is really, really important. The experimentation, bringing together some of the great thinkers in the medtech companies that we work with, in the practitioners, in some of the charities that we work with. We do some really great work with the Red Cross in Spain, looking at the impact of loneliness on health. So how do we bring together all of those amazing groups that we work with and start to look at some of the big problems that we can see post-pandemic?
So I'm sure that listening, we're going to have charities, we're going to have hospitals, we're going to have primary care facilities. So to some extent, if any of those sort of groups of people have experimentation that they want to do around some of this technology, I guess you're open for contact, so to speak.
Definitely. And I think, one of the great things about Vodafone and Deloitte is we're starting in 4 European countries. So we're focusing on Germany, Italy, Spain, and slightly separately the UK. And then we've got other European countries coming on board and our presence in Africa. So we've got a roadmap that says we start in 4 key countries. We start to put the infrastructure and the ways of working together, and then we bring more European countries on board, and we expand some of the work that we're already doing in Africa. So I think it'll be a case of being able to share knowledge. Some of the things that we've done, for instance, is we've been quite good at doing hackathons and sponsored virtual sandboxes. So there's lots of things we can do to get some of that great experimentation really brought to the fore.
Fantastic. And I'm sure that the ECH Alliance ecosystems in some of the countries like Germany, Italy, and Spain, this is an opportunity for them to be able to get involved in and see what you're doing and perhaps being able to test some of the technologies with you. So for those people who are listening, I encourage them to think of Vodafone. I guess things like the Recovery and Resilience Fund, is that of interest to Vodafone? Because that potentially is a source of funding for some of these organizations to be able to experiment with this sort of technology, isn't it?
Definitely. And we see lots of possibility that is springing off already from the European Resilience and Recovery Facility. Everything from research and development. So those new technologies that I'm talking about, how can we really accelerate the prototyping? How can we share knowledge across the European countries? But also, how can we really start to put a stronger digital infrastructure in place? One thing that the pandemic has really highlighted is the inequalities in really critical services like education and healthcare. So how do we make sure that you can get access to advice and guidance? It's not, even before you need to physically see a clinician, how can we help you get that peace of mind or, take steps to improve your health through the better sharing of knowledge and expertise? And we can see already working with the governments in most of the European countries, there's some, amazing plans coming together for how we all want to accelerate digitalisation, because we can see that it's a way that we can extend some of the healthcare capabilities that we have today. We can't keep doing the same thing over and over again and suddenly expecting more people to be able to have access. So I think the Resilience and Recovery Facility is going to help us find new ways of delivering healthcare. Great.
And yesterday we heard from the European Patients Forum. They used the word digital hesitancy, and they were comparing that to, if you like, vaccine hesitancy. And to some extent, either the absence of information that ordinary citizens can understand. And it strikes me that many of the things that you as a company have been working with for decades, whether that's security in terms of data transfer, whether it's compliance with regulations such as GDPR, and I guess that there's a fantastic opportunity for the centre to be able to contribute to educating in a very clear way to ordinary people the benefits of some of these technologies. Do you think that's something that you can see the centre doing?
Definitely. And I think a lot of experience that we gained over the last 10 years of helping employees and private citizens to adopt new technologies. If I look back 10 years ago, social media wasn't a thing. We wouldn't have used our televisions to connect with our family members when we couldn't see them. So we've got a huge amount of learning on how individuals adopt technology and where the barriers are, and we can apply that into the healthcare environment. And that's where, Deloitte do really big transformation programs. They really understand what are that digital hesitancy, exactly what you talk about there. Is this the right thing to do? The first few times you use it, how do you ensure that you're going to get the outcome you want? Or how do you make sure that you don't break something? Overcoming that digital hesitancy. Now, what we've seen is citizens, their digital hesitancy is dropping very quickly. They are grabbing new technologies. They're finding new ways to keep connected with their families and even to work remotely from home. How many thousands of citizens in Europe have in the last 18 months completely changed the way they work? We can take all of that learning and all of that reassurance and simplification into the points at which healthcare is delivered. And I think the key to this digital hesitancy, you hit the nail on the head there, is simplicity. It's got to be simple. It's got to be easy to understand.
Katrina, thank you very much. Fantastic insight. I wish the centre the best of good luck and fortune. And I hope we are able to work with you again. Thank you very much indeed.
Thank you. Have a good rest of the day. Bye-bye.
Thank you.